Do you realize that it's $1 trillion in cuts to Medicare and Medicaid? That's a trillion with a T. So yeah, they're giving 50 billion while they're taking away 1,000 billion. That's like robbing your bank account, handing you back a coupon, and then calling it a blessing. They're calling it the Rural Healthcare Transformation Program. And while that sounds nice, and $10 billion a year spread out over 5 years, half of it gets split evenly among all the states. The other half is based on rural population. But what they're leaving out is that it's buried inside a mega bill that slashes Medicaid and undercuts ACA subsidies. Those subsidies are the tax credits that let working families actually afford insurance. So you can't cut the lifeline and then pretend that the Band-Aid is a miracle cure.
Rural hospitals are closing, and the bill that's supposed to save them is the one killing them. Nearly $1 trillion in Medicaid cuts, dressed up with a $50 billion headline, sold as reform. The counties hurting the most voted for this. The hospitals on the chopping block are kept alive by the exact programs getting gutted. Today we break down exactly how that works. Welcome back to Mind Mirror. Let's get into it.
Oh, Michael, sweetie, this is a little embarrassing for you because here's the thing, I have read the bill, and not only that is I actually read other news sources and can compare and contrast and analyze the information I'm finding to come to my own conclusion instead of just reiterating the gibberish that I find online. But anyways, I also can admit when other people are right. And you know what? Good job, Michael. You are right. The bill does say it's going to provide $50 billion to rural hospitals over a 5-year period. But guess what else is happening, Michael? There's going to be, and I got some notes down for you, just to get my numbers right for you. $793 billion is going to be cut from medical services because of this bill. Specifically, $119 billion in rural areas over the next 10 years, meaning this $50 billion isn't even half of which will be lost, okay?
$793 billion cut, $50 billion returned. And they called that a deal. That's not a rescue plan. That's a math problem with the PR team. You cannot slash the lifeline and then hand someone a Band-Aid and call yourself a hero. And the timing alone exposes it. Cuts run for 10 years, the help runs for 5. So what happens in year 6? Silence, because by then the damage is already locked in. This is what legislative sleight of hand looks like up close. Keep your eyes on the headline, never on the fine print.
Now let's go into a little bit of specific numbers. So 20% of the US populations live in rural areas, and 1 in 4 of them, 1 in 4, are on Medicaid. Specifically, 1.8 million people. And of those people that are on Medicaid in rural areas, nearly half of the babies born in rural America are done so on Medicaid. 65% of nursing homes in rural area receive Medicaid. And 40% of children in rural America are on Medicaid.
This is the part people need to actually sit with. 40% of kids, nearly half of all births, 65% of nursing homes. These aren't numbers from some coastal city. This is rural America's own data, so the no handouts crowd is the same crowd keeping their local hospital open through Medicaid. That's not hypocrisy, that's just reality refusing to cooperate with the talking points. You can't gut the program and protect the community. Those two things are not compatible. Pick one.
So I'm going on a branch here and saying that maybe you might be pro-life or consider yourself pro-life. These numbers don't add up to that, okay? 40% of children and nearly half of the births in rural America depend on Medicaid, funding that is going to be cut in the big, ugly bill.
So presently, we don't have a government. And here's why we don't have a government. The Republicans wanted to take away your health care. They wanted to take away that was kind of like the last nail in the coffin of American civil life, right? Is taking your health care away from you. So granny dies of diabetes and your child dies of Victorian era illnesses. What?
Victorian era illnesses. She said it and she meant it, measles. Measles is back. That's not a punchline. That's a public health failure happening in real time. And the communities most exposed to these outbreaks are the same ones losing access to the clinics that would catch it early. No hospital nearby means no early detection. No early detection means it spreads. This isn't about left or right. It's about whether people get sick and die from something we already solved 60 years ago. That's it. That's the whole conversation.
They wanted to take away our health care. But in order to do that, they were going to claim that Democrats in Senate and in Congress wanted to give it to people who are here undocumented. Even though people who are here undocumented don't have Medicaid, they can't get benefits. They can get treated in a hospital because of ethics, but they're going to get a bill. No matter how many times the Republicans say, "Oh, Democrats want to give illegal," I don't care. Does that mean I shouldn't have mine? You shouldn't have yours? So thank you, Democrats, for getting the balls to walk off the floor of a fight where the opposite team has torn up the rule book and thrown it away. I ain't going to play that game with them. No, I want you to come back, and I want you to play as hard, as tough, and as unfair, because if these motherfuckers are ever out of office.
Good. Walk, because here's what nobody wants to say out loud. Playing by the rules when the other side has abandoned them isn't noble. It's just losing politely. They've been called spineless for years. Too soft, too procedural, too willing to compromise into a corner. So the second they actually hold the line, suddenly it's obstruction? Suddenly it's hostage-taking? No, that's called leverage. Welcome to the game they've been playing alone for a decade.
If they have not sewn us into some modern-day Orwellian remake, because you know Hollywood loves the remakes, I want you to come back as fierce and ferociously as you did. I want Donald Trump erased from the White House. I don't want his portrait hanging there. I want this country to forget this ugly chapter for every woman, for every brown person, for every black person, for every gay person, for every trans person, for every child, for every elderly person who is dependent on medication, for every disabled person who has to have accessibility in order to survive in this country. They would rather see you dead. And they're going to sit there and say that the reason Democrats shut down, that they can even get that far and try to convince you that Democrats shut down government when Republicans are the ones who left town and refused to continue to deal with Democrats and instead insisted they take away your health care access. I would say, Democrats, go on a long vacation, honey. Don't let them do a damn thing. Have a good day.
Everything. They're on board with that program. They think the government can do a better job by taking over healthcare. We believe in the private sector and the free market and individual providers.
This really pisses me off. When Republicans stand up there and say that the Democrats are holding America hostage, that's bullshit. All right, because the plan that they're pushing isn't going to save anyone. It's gutting healthcare from the inside out. And they're waving around this headline about $50 billion for rural healthcare like it's some kind of heroic act of generosity. Do you realize that it's $1 trillion in cuts to Medicare and Medicaid? That's $1 trillion with a T. So yeah, they're giving $50 billion while they're taking away $1,000 billion. That's like robbing your bank account, handing you back a coupon, and then calling it a blessing. They're calling it the Rural Healthcare Transformation Program. And while that sounds nice, and $10 billion a year spread out over 5 years, half of it gets split evenly among all the states. The other half is based on rural population.
Stop. Just stop and do the math with me for a second. $10 billion a year, split 50 ways. That's $200 million per state, per year, for rural healthcare infrastructure. In states where some counties have one hospital serving 30,000 people across hundreds of square miles, $200 million sounds big until you realize a single rural hospital system can run $150 million annually just in operating costs. This isn't funding, it's a gesture. A symbolic gesture with a really good press release attached to it.
But what they're leaving out is that it's buried inside a mega bill that slashes Medicaid and undercuts ACA subsidies. Those subsidies are the tax credits that let working families actually afford insurance. So you can't cut the lifeline and then pretend that the Band-Aid is a miracle cure.
This line right here is the entire argument compressed into one sentence. ACA subsidies are what keep working people insured, not wealthy people, not people on full Medicaid. The people in the middle, the ones working 2 jobs, the ones 1 medical bill away from financial collapse. Cut those subsidies, those people go uninsured. Uninsured people delay care. Delayed care becomes emergency care. Emergency care is the most expensive care. Rural hospitals absorb the cost. Rural hospitals close. That's not a theory. That's the documented cycle, and they're choosing to run it again.
When people lose insurance, hospitals lose money. And when hospitals lose money, they close, especially rural ones. And when they close, they don't come back. And the thing that's really fucked here is that Donald Trump Jr. has joined the board of BlinkRx, and that's an online drug delivery company. They make money shipping prescriptions directly to people. And Republicans just built a fund that dumps billions into telehealth and remote delivery systems. Do you see where that's going? When rural hospitals close, companies like BlinkRx will step in and take over those patients, delivering medicine through a screen instead of a doctor's visit. And those contracts, those systems, they're funded directly from that $50 billion plot. So while your local hospital shuts down, Donald Trump Jr.'s company gets a slice of the so-called rural health fund.
Let me be very clear about what's being described here. Close the local hospital, which drives patients toward remote and delivery-based care, which a company conveniently positioned in advance now profits from. Funded by the same bill that closed the hospital, that's not coincidence. That's architecture. That's a system designed with the outcome already written, and the people in those towns will never connect those dots because it happens slowly, over years, with enough political noise to drown out the pattern.
That's a privatization plan. It's the same game. Starve the public systems, watch them fail, then hand what's left to your corporate friends. They call it efficiency, I call it theft. Once those hospitals are gone, so are the ERs, the maternity wards, and the jobs. And those same politicians who voted to gut healthcare will turn around and say, see, told you government doesn't work. But it did, until they strangled it. So let's get this record straight. Democrats didn't block healthcare. They blocked a scam. Because this isn't a rescue plan. It's a hostile takeover of rural healthcare. If you want to actually fix it, protect Medicaid, extend the ACA subsidies, and fund health care that keeps people covered, not corporations rich. The ACA subsidies keep people insured. Medicaid keeps rural hospitals alive. Those two things literally save lives. The Republican plan cuts both, and they want to call it reform. So the next time they say Democrats are holding America hostage, remember this. They're not fighting for patients. They're fighting for profits. They're cutting $1 trillion and throwing back $50 billion and calling that even. So when that last hospital in your county closes and your grandma's heart meds show up in a Trump-branded box, remember, that did not happen by accident. That happened by design. Look out for yourselves. Look out for a neighbor, and look out for a stranger.
4 words, and she just ended the entire debate until they strangled it. That is the playbook, documented, repeatable, proven. Underfund the public system. Watch it struggle. Point at the struggle as evidence it doesn't work. Hand it to the private sector. Call it reform. It happened with public transit. It happened with public schools in certain districts. And now it's happening with rural healthcare. Same play, different jersey.
Y'all keep doing good.
This whole thing about Trump sending a hospital ship to Greenland is even dumber than you think. So you're probably seeing coverage about how Donald Trump was tweeting about sending a hospital ship, working with the Louisiana governor who has like the worst health outcomes in his state in the country. And this coming from Donald Trump, whose HHS secretary is gutting health protections for Americans, the country that has made measles great again. We're going to go send a hospital ship to a country that has free healthcare access for all. You want to know why? Because Donald Trump saw that a U.S. Navy sailor who was in a submarine off of the coast of Greenland needed medical attention and needed to be evacuated by the Danish military. So because one U.S. Navy sailor had a medical emergency and it was the military of Denmark that had to rescue that sailor, Donald Trump is going to send a ship that is currently in Alabama up to Greenland to try to save face and make it look like Denmark, Greenland could never provide anything medical of any kind to Americans. Like, this is the dumbest thing in the world.
Major news right now, a number of federally funded healthcare clinics still do not have access to funds because Donald Trump froze their federal assistance even after a judge told Trump that he can't do that. 3 Virginia health clinics for lower income patients closed today because their federal funding remained frozen. The 3 clinics are part of a larger national network of federally financed clinics that offer care to more than 30 million people, many of whom are uninsured or on Medicaid. Other Virginia clinics have stayed open by relying on savings while they wait for their funds to come through, but those savings are expected to dry up very quickly, leading to more closures of more clinics. A spokesperson for the Virginia Community Healthcare Association said it was unclear why certain clinics could access their funds and others couldn't, but they know the problem came from Donald Trump's freeze on federal assistance. So just to be abundantly clear, there are low-income Americans out there who rely on these clinics who now do not have access to them because of Donald Trump. What Donald Trump has done to this country in just over 2 weeks is nothing short of disgraceful. If TikTok ever gets banned, my Instagram, my YouTube, and my Substack are linked in my bio. That's where I'm going to be.
A federal judge issued an order. The clinics stayed closed anyway. 3 of them. Virginia. Today. Real patients, no access. Not because of bureaucratic delay, not because of paperwork, because the freeze held even after a court said it couldn't. That's not a policy failure. That's institutional contempt. And the people paying the price are the ones with the least ability to absorb it. Uninsured, low income, no alternatives. This is what it looks like when the machine decides certain people don't matter enough to follow the law for.
Hey, it's Joe from Georgia. So we do know this week in the reconciliation bill that was passed by the House by 1 vote, by the way, 215 to 214. One of its mainstays is to cut Medicaid by $880 billion. Well, let me tell you that's going to result in. The cuts to Medicaid in this number are going to cause an immediate risk to closing over 300 rural hospitals across America. And the states mostly affected are Kansas, Texas, Oklahoma, Tennessee, Mississippi, and Alabama. Now, you'll see that follows a pattern. So those rural hospitals that people depend on, they'll close. And the other thing is with their long-term care facilities that are located in those hospitals, Aunt Louise and Grandma are going to need a place to go because when Medicaid quits paying their bill, they're going to remove them. And they're going to have to come back home and live with you. You're going to have to provide their health care or they'll be homeless on the street. Because if these places aren't being paid by Medicaid, and by the way, rural hospitals gets 80% of their funds.
Oh my god, there is the most insane message thread happening on the Medicine Hat Roast and Toast right now. So I just love women. So I'm going to show you some screenshots of this happening and give you some context first before I show you. So really early this morning at like 5 in the morning, I was awake. So I opened Facebook and see this post. It's a shocking post, okay? It's literally someone posting from the Emerge, showing this massive blood clot, complaining about the healthcare she's receiving. And I was first like taken aback too, because, you know, it's really graphic and you're not really prepared for that. And she just posted it like 5 minutes ago, and already there's comments and it's all men getting offended. And I'm like, oh my gosh, like, okay, let's look at this clot here and let me just think about this for a second, because clearly this woman's scared for her life. She thinks she's dying, and like she's been put through the ringer, and like she's not getting the care she needs. They're telling her that nothing's really wrong, and she's mad now at this point because she's been given a bunch of birth control and she's been bleeding this bad for months. And so yeah, she's just kind of freaking out. So I'm like, first of all, I'm like, okay, I don't think you're dying, but like, yes, this is definitely a problem. Like, what's the story? This other woman pops on and she just happens to know quite a bit about that uterine women's health as well. And I'm just like, I just decide, I'm like, I need to say something to these dudes, because like they're being assholes, being like, wow, you're disgusting. Like, before you post a photo essay, like maybe just chill out type of deal. Okay, so I'll show you the screenshots. So I responded to this. This was like 5:30 in the morning. It's now like 12:30, and like there's so many women backing me up and like calling these guys out too. Okay, I'll show you. Okay, so to be fair and validate their experience, yes, it was a shocking image. I'm not going to show it on this app because I feel like it is really graphic, so I'm just going to leave it. Here's the anonymous member's comment. Here's my response. You can pause to read these too. I'm just going to scroll here. My name is Megan, by the way. So look at all these women. You know, you can always go to this page. It's the Medicine Hat Roast and Toast page. If you're interested in the link, I can send it to you in my DMs if you message me or drop me a comment. So this guy, Nate, okay, he's trying to play it off like he did nothing wrong, but like, isn't with women's health a euphemism for the murder of helpless babies? So I said, dude, just stop and go call a therapist instead of watching MAGA online content. And again, more women. This is hate speech, he says. No, it's called having boundaries. Okay, so that's that. So to summarize, you saw the tea, and this is just goes to show that speaking up and standing up for yourself and calling out that kind of stuff does make a difference. And I'm just really proud of myself and all those women for speaking up.
So here's the bottom line. $1 trillion cut, $50 billion returned, clinics closing despite court orders, a privatization structure quietly baked into the same bill being sold as a lifeline. When that hospital closes, it doesn't come back. That's not pessimism. That's the historical record. The numbers already answered whether this is reform or a racket. The only question is whether enough people read past the headline. Drop a comment, share this with someone who needs the math, not the talking points, and subscribe, because we're not done pulling on this thread. See you in the next one.